Focus on matters health for the health workers who are taking care of Kenyans who are positive, COVID-19 positive. And the Kenya Medical Practitioners and Dentists Union has asked the government to prioritize safety of health workers by ensuring they receive personal protective equipment, that is PPEs. The union is also demanding that the government compensates health workers who contract COVID-19 as well as pay the medical bills. Now, KMPDU Secretary General Dr. Chibanzi Mwachonda said loss of our health workers was demoralizing and hence the need to assure them of their safety. Now, he spoke during a press conference on Saturday after the county lost its first medical doctor to coronavirus.
I think you all remember earlier on when the pandemic had been declared in our country, we raised the issue of infection amongst healthcare workers. And unfortunately, we were dismissed as fantasizers. We are doctors, and I say we are doctors because we understand disease. We understand the risk, we understand the prognosis. By the time the disease was declared in our country, we had all seen how it had ravaged healthcare workers across the globe. And I even said that there is no amount of money that will compensate a family for the loss of their loved one.
Insist and emphasize that the compensation package, the insurance package for the healthcare workers must be implemented. It must be implemented. This is not a request, this is a demand, because it's a right that the frontline soldiers be protected when they are fighting this COVID-19.
So we've heard it from the leadership of the Kenya Medical Practitioners and Dentists Union when it comes to the safety of health workers, especially doctors in the country. And I'd like us to take this conversation further with Dr. Alan Ochanji, who's the second vice chairman at the KMPDU. And thank you so much, Daktari, for talking to us here on KTN News Center this morning. As we speak, so far we know it is 292 health workers who've contracted COVID-19 while on duty. But can you confirm to us how many health workers have lost their lives due to COVID-19 in Kenya?
Thank you for having me. Good morning. We can only confirm that the first doctor who lost her life is the one that we are laying to rest today. We also have a number who have contracted the disease and are either in treatment or in isolation or they're recovering. The data as given as of the last conference is as it is. We'll give more updates as we get the numbers. But we're not happy with the numbers and we're not happy in terms of how they're protected.
Talking about not being happy when it comes to how the government has handled the safety of health workers, the KMPDU claims that the government is also yet to come clear on the issue of settlement of bills by health workers.
Precisely, because if a healthcare worker today contracts COVID, they're left to foot the whole bill of treatment, of isolation, of quarantine on their own. There's no compensation package defined for them. They don't have a comprehensive medical insurance. Our proposal was very clear that the NHIF comprehensive insurance for all civil servants be extended to all doctors. As it is right now, we have very many counties where healthcare workers are working with very junior insurance packages. So as it is, there's no compensation. If you contract the disease, you're left on your own to quarantine. If you contract the disease, there's no comprehensive medical insurance. And you know, as it is right now, it's the same scenario as it was when Kenya went to Somalia for war. Right now, we're at war with the virus, not with enemies. And the soldiers in this case are healthcare workers. So they need to be protected the most if we have to conquer the war against the virus.
So, Dr. Ochanji, what you're confirming to us here on KTN News Center, it is that the compensation package that the president had talked about earlier this year when he reported the first COVID-19 case is yet to be implemented.
We are yet to see anything in terms of either motivation in terms of a monetary package hitting the accounts. The PPEs we've been getting, some of them are substandard. They don't reach all healthcare workers. In some cases, healthcare workers are left to sort of come with a makeshift ways of covering themselves. Some have to go out of their ways to buy for themselves so that they have to work. So in terms of what the president said, it was a very good move and a very good directive. But unfortunately, as to up to now when we're talking with you, most of those have not been implemented. There was a proposal that each healthcare workers be given a cross-board health risk allowance. Even as we speak today, that is yet to be achieved.
Proposal, Daktari. Some time back, the union had presented a proposal to the Senate ad hoc committee that was handling COVID-19 cases in the country, and you had given a proposal to ensure that the government has a dedicated isolation facility for health workers. This has not been implemented also?
You know, when we were giving this proposal, we were very reasonable and we were looking at the practicality of everything. So our suggestion was look at a facility and do not go very far. Just identify a local, maybe hotel or a building or a restaurant, renovate it, do it so nicely so that when a healthcare worker leaves the place of work, they do not go home directly. Because remember, they also have their families. You don't want the virus to be taken home to vulnerable people, to vulnerable children. So you have a holding facility sort of, so that when they leave work, they go to that place, they change, leave everything there. Then as they leave home, they don't carry the virus home. Those are things that are very cheap. They don't need monetary, very huge budgetary implication. We're just putting a priority here and there so that we protect healthcare workers because the number is so small. If we have every healthcare workers in quarantine instead of being in the hospital, then which scenario are we exposing Kenyans to?
As we wind up, let's talk about the cost of treatment when it comes to COVID-19. KMPDU has been very vocal, asking the government to reduce the cost of treatment because some time back, the DG for Health, that is Dr. Patrick Amoth, said that it costs Kenyans 21,400 for mild cases, 21,500 for severe cases.
It's very expensive, to be honest, for a common Kenyan, because our public facilities are stretched. Sometimes we don't have insufficient places of holding. We don't have insufficient isolation centers. We have not seen the counties preparing the 300-bed capacity isolation facilities being put in place. So sometimes it's upon a Kenyan to foot the whole bill. I'll give you an example. If you go to Aga Khan today, the cost of testing COVID alone is almost 13,000. You've not added anything in terms of medication or what you need to keep you going. Then the cost of isolation will be on you. The cost of quarantine will be on you. So it's ridiculous on top of the psychological torture and the family values that you're also going through. It's very, very expensive. And if the government would put up a plan where your testing is guaranteed, if you are tested, the way you will be handled in terms of isolation and quarantine is guaranteed, your treatment is taken care of, then it will be cheaper because on top of the COVID treatment alone, there are also other economic circumstances around COVID that is also affecting the same person.
So much, Daktari. Dr. Alan Ochanji, Second Vice Chairman, KMPDU, talking to us about the safety of health workers, even as they bid farewell to the doctor who died because of COVID, due to COVID-19 last week on a Thursday. My name is Brenda Zedaradido. I bring it to an end for the first of KTN News Center. I see you again at 10 a.m. Keep it KTN News for more stories making the headlines.